Hi, my name is Valentine from Montreal NewTech, and I want to do a quick video to show you how to use Hopin for your next event. So the first thing you need to do is identify yourself properly or provide a generous donation and just do the checkout. If that's your first time on Hopin, fear not. You need to create an account, but it's really fast, or you can use one of the alternative authentication method. In all cases, they don't send much message and the service works really, really well. So you'll be greeted with the reception area. That's where, again, this is a test in this case, where you see the programming, have a bit more information on the content you're going to see. Right now, you see there's a stage and the stage is live. So the day of the event, what you're going to see there is going to be the keynote speakers, the panels, providing all that good content. And of course, there's a chat room that will be running for the stage, but also there's another chat room for the whole event. You can always get in touch with everyone that will be part of that event here. And it's a fantastic way to make the best use of that experience, which is get connected with people. Speaking of getting connected, we also provide workshops or sessions that are related to different fields. You can connect to it, be a part of the discussion, or just follow along, chat with people. And also we have the networking area where those people, you'll be matched randomly with one of those with the people from the audience, and you can start a discussion there. You can always have your messages here or search for specific people. Fantastic way if you have a startup, if you're already a professional in the ecosystem, if you're a student, it's a fantastic way to better understand the ecosystem. And last thing I want to show you is the expo session. That's where we have the traditional booths that are from a partner, so you can get in touch directly with them, ask your questions, and interact. So that's super quick tour of Hopin. You'll see it's really easy to use, and see you at the event. Bonjour, mon nom est Valentin de Montréal NewTech et j'ai envie de vous montrer la plateforme Hopin qu'on va utiliser pour notre prochain événement pour s'assurer que votre expérience soit somme toute assez agréable. Donc, la première chose à faire, naturellement, c'est d'aller sur le lien de l'événement. Dans ce cas-ci, j'ai créé un test pour vous montrer comment ça fonctionne. Donc, normalement, on s'entend qu'il n'y aura pas de grande mention en rouge, écrit test. Première étape, il suffit de vous identifier ou bien d'ajouter une donation, qui sont toujours appréciées. Si vous n'avez pas de compte, Hopin va vous demander d'en créer un, ou bien vous pouvez vous authentifier avec une des plateformes alternatives. Honnêtement, Hopin, ça fonctionne très bien. Probablement, certains d'entre vous ont déjà un compte. Ils n'envoient pas de spam ou quoi que ce soit. N'hésitez pas à vous connecter. La première chose que vous allez voir quand vous rentrez, c'est la zone de réception. C'est là où vous allez voir un peu l'information sur le programme, les partenaires et au fond, le programme, le calendrier de l'événement. En ce moment, vous voyez qu'il y a un stage qui est live. Normalement, c'est un test en ce moment, mais normalement, ce que vous allez voir, c'est que vous allez voir les keynotes, les speakers, les panélistes qui vont être ici. Vous avez toujours une fenêtre de discussion qui est en lien avec le stage, le main stage, mais aussi avec à l'échelle de l'événement au complet. Quelque chose qui fait partie de l'événement également qui est très important, c'est les breakout sessions, donc les sessions qui font partie de la programmation. Vous pouvez vous connecter dedans, vous pouvez allumer votre webcam et participer. Même chose, vous pouvez chatter avec les personnes à l'intérieur. Et si vous êtes étudiant, si vous êtes professionnel, si vous avez une startup, la fonction networking est très, très intéressante parce qu'au fond, vous allez être connecté avec, bon, en ce moment, c'est moi tout seul, mais vous allez voir le jour de l'événement, ça va être plus occupé. Vous allez être connecté avec des personnes qui veulent aussi réseauter. Et dans tous les cas, vous pouvez chercher des personnes en particulier et également leur envoyer des messages. La dernière chose que je vais vous montrer rapidement, c'est la section Expo. Donc, c'est un peu comme les booths traditionnels qu'on voit dans un événement. C'est l'ensemble des partenaires, des personnes qui sont impliquées dans l'événement. Vous pouvez directement rentrer en contact avec eux, discuter, poser vos questions, etc. Donc voilà, c'était un aperçu très très rapide de Hopin. Honnêtement, la plateforme fonctionne très très bien. Sinon, vous pouvez me retrouver ou les différents bénévoles de Montréal NewTech pour nous poser des questions si vous avez des difficultés. Voilà, on se voit le jour de l'événement. Hi, my name is Valentine from Montreal NewTech, and I want to do a quick video to show you how to use Hopin for your next event. So the first thing you need to do is identify yourself properly or provide a generous donation and just do the checkout. If that's your first time on Hopin, fear not. You need to create an account, but it's really fast, or you can use one of the alternative authentication method. In all cases, they don't send much message and the service works really, really well. So you'll be greeted with the reception area. That's where, again, this is a test in this case, where you see the programming, have a bit more information on the content you're going to see. Right now, you see there's a stage and the stage is live. So the day of the event, what you're going to see there is going to be the keynote speakers, the panels, providing all the good content. And of course, there's a chat room that will be running for the stage, but also there's another chat room for the whole event. You can always get in touch with everyone that will be part of that event here. And it's a fantastic way to make the best use of that experience, which is get connected with people. Speaking of getting connected, we also provide workshops or sessions that are related to different fields. You can connect to it, be a part of the discussion, or just follow along, chat with people. And also we have the networking area where those people, you'll be matched randomly with one of those with the people from the audience, and you can start a discussion there. You can always have your messages here or search for specific people. Fantastic way if you have a startup, if you're already a professional in the ecosystem, if you're a student, it's a fantastic way to better understand the ecosystem. And last thing I want to show you is the expo session. That's where we have the traditional booths that are from a partner, so you can get in touch directly with them, ask your questions, and interact. So that's super quick tour of Hopin. You'll see it's really easy to use, and see you at the event. Bonjour, mon nom est Valentin de Montréal NewTech et j'ai envie de vous montrer la plateforme Hopin qu'on va utiliser pour notre prochain événement pour s'assurer que votre expérience soit somme toute assez agréable. Donc, la première chose à faire, naturellement, c'est d'aller sur le lien de l'événement. Dans ce cas-ci, j'ai créé un test pour vous montrer comment ça fonctionne. Donc, normalement, on s'entend qu'il n'y aura pas de grande mention en rouge, écrit test. Première étape, il suffit de vous identifier ou bien d'ajouter une donation, qui sont toujours appréciées. Si vous n'avez pas de compte, Hopin va vous demander d'en créer un, ou bien vous pouvez vous authentifier avec une des plateformes alternatives. Honnêtement, Hopin, ça fonctionne très bien. Probablement, certains d'entre vous ont déjà un compte. Ils n'envoient pas de spam ou quoi que ce soit. N'hésitez pas à vous connecter. La première chose que vous allez voir quand vous rentrez, c'est la zone de réception. C'est là où vous allez voir un peu l'information sur le programme, les partenaires et au fond, le programme, le calendrier de l'événement. En ce moment, vous voyez qu'il y a un stage qui est live. Normalement, c'est un test en ce moment, mais normalement, ce que vous allez voir, c'est que vous allez voir les keynotes, les speakers, les panélistes qui vont être ici. Vous avez toujours une fenêtre de discussion qui est en lien avec le stage, le main stage, mais aussi avec à l'échelle de l'événement au complet. Quelque chose qui fait partie de l'événement également qui est très important, c'est les breakout sessions, donc les sessions qui font partie de la programmation. Vous pouvez vous connecter dedans, vous pouvez allumer votre webcam et participer. Même chose, vous pouvez chatter avec les personnes à l'intérieur. Et si vous êtes étudiant, si vous êtes professionnel, si vous avez une startup, la fonction networking est très, très intéressante parce qu'au fond, vous allez être connecté avec, bon, en ce moment, c'est moi tout seul, mais vous allez voir le jour de l'événement, ça va être plus occupé. Vous allez être connecté avec des personnes qui veulent aussi réseauter. Et dans tous les cas, vous pouvez chercher des personnes en particulier et également leur envoyer des messages. La dernière chose que je vais vous montrer rapidement, c'est la section Expo. Donc, c'est un peu comme les booths traditionnels qu'on voit dans un événement. C'est l'ensemble des partenaires, des personnes qui sont impliquées dans l'événement. Vous pouvez directement rentrer en contact avec eux, discuter, poser vos questions, etc. Donc voilà, c'était un aperçu très très rapide de Hopin. Honnêtement, la plateforme fonctionne très très bien. Sinon, vous pouvez me retrouver ou les différents bénévoles de Montréal NewTech pour nous poser des questions si vous avez des difficultés. Voilà, on se voit le jour de l'événement.
Good morning, good afternoon, and good evening to all of our attendees joining us today for a special edition of Creative Collisions. My name is Yada Shamas, and I am the community lead here at Montreal NewTech. I am joined by my wonderful co-host, Alejandro Martinez. Alejandro, how are you doing today?
Hello, Yara. It's amazing today. Beautiful day, sunny, and then with amazing company.
It is always great to be finding a way to come together during times of COVID. So I definitely feel grateful to also be part of our event today. Our topic today is on tech and collaborations that are shaping the future of life sciences as we know it. Alejandro, why don't you give us a quick preview on what Creative Collisions really is all about and what people can expect from today?
Thank you, Jara, for highlighting this for today. Today we have an amazing program for the people to enjoy. First of all, today is the Open Innovation Day in the life science healthcare sector, and the program is divided into three parts. The first part is the Conference of Creative Collisions. Then after, we have 10 amazing startups pitching during the pitch effervescence pitch competition, and then we'll have networking.
Wow, that's amazing. Can you tell us who is going to be overseeing the breakouts for today?
Well, the program for the Creative Collisions is amazing. First of all, Creative Collisions is about bringing together startups, researchers, and industries come together to discuss collaborations and then brainstorming about how to solve a particular problem that humankind faces in the light of the technology that is being developed by the researchers and the startups themselves. So we will start with a panel discussion there. Then after, we'll have the breakout sessions, 3 of them. And there we have special guests. We have AstraZeneca, we have Johnson & Johnson Innovations, and then we have also Servier Laboratories that are joining there. They are coming here, is not just for looking at things. They really have serious plans to check out what the technology is there developed by the startups and researchers. And I'm really, really eager to see all that.
As an aspiring entrepreneur myself, I can see how all of this content can really help shape the way we see the world. I want to start by making sure we thank all of the partners that made sure today, a day like today happened. Alejandro, who can we send a lot of love to?
Oh, we need to send a lot of love and a huge thank you to our collaborators and co-organizers. Without them, this wouldn't be possible. Centech, District 3, Desjardins Open Innovation, Montreal InVivo, and especially to the Ministère of Technology de l'Innovation de Quebec, because without their support, this conference and they wouldn't be possible. But one more part, like the team of Montreal NewTech, they've been hustling really hard. Without them, it would be really, really hard to put this together.
Absolutely. No event is an easy task to take on. We want to make sure that the conversation today lives beyond the walls of this digital venue. So make sure to leverage our event hashtag to keep the conversation alive. We want to be hearing from all of you today. But without further ado, I want to make sure I welcome my colleague, Elias, who is going to be leading the first segment of today. Elias, are you here?
Absolutely. Well, I hope so. At least I see myself here. So j'espère bien que je suis là.
You are here.
Good to see you. Good to see you. And thanks for having me. Vraiment très, très heureux d'être là. Je sais que c'est une grande après-midi. C'est dans le cadre de la conférence Effervescence. On est live ici de Montréal. Alejandro aussi, toi, je pense que tu es ailleurs dans le monde. You are somewhere else in the world. And that's the beauty of the situation we're having. I know it has been a year. It actually has been a year that COVID hit. And we've been hustling and struggling all around the world, and especially here in Canada, to not only tackle it, but also collaborate to develop innovations to answer this pandemic, but also to look in the future. And I think today, marking in a way a bit of a sad anniversary, but realistically, 1 year of COVID, it's the right time to not only look at what has happened in our ecosystem from a collaborative perspective, as well as project ourselves in the next 10 or 20 years. And how can we as an ecosystem come together, collaborate between researchers, entrepreneurs, and enterprises to develop and create the future of healthcare and life science. no one can actually predict it really, even though during our panel in a few seconds, we're going to talk about that. But the best way to predict the future is to actually build it. So we're all coming together to do that. Je suis live de Montréal. La conférence est dans un cadre de effervescence. Donc, nos amis de Montréal InVivo et plein d'autres acteurs et actrices à travers le Canada se sont mis ensemble pour cette conférence annuelle-là, qui est majoritairement en anglais. Comme vous le savez, Montréal NewTech, basé à Montréal, Desjardins, basé au Québec, et toutes les collaboratrices et collaborateurs dont on a parlé, District 3, Centech et plein d'autres, sont bilingues, évidemment. Cependant, la suite de la conférence va avoir lieu en anglais pour faciliter les choses, la compréhension entre tout le monde, car on veut évidemment qu'il y ait un maximum de collaboration, de confiance qui se crée entre les différentes actrices et acteurs. Et je voudrais souligner, je pense que vous l'avez vu dans les slides, moi je n'étais pas là, j'étais en train de faire mon setup ici, là, mais on a dépassé les 600 inscrits à travers justement cette collaboration entre différentes organisations. Et ce dont je suis extrêmement fier, puis merci à toutes les participantes et les participants, c'est qu'il y a à peu près un tiers de chercheurs, un tiers de startups et d'entrepreneurs et un tiers à peu près d'entreprises, de fonds d'investissement, d'écosystèmes de support, etc. Et on croit fortement à rassembler ces différentes actrices et acteurs pour permettre de tisser des liens de confiance entre elles et eux, ainsi que explorer des collaborations possibles. On va avoir 3 sujets d'approfondissement d'innovation. We're going to have 3 specific challenges to dive deeper into the collaborative innovation. I don't know if Alejandro or Yara, you've talked about them, but we'll talk about quantum computing, AI, and IoT, wearables, etc., with AstraZeneca, JLabs, and Servier, as well as to set the table, pun intended. We're having a wonderful panel. I'm not going to introduce it because they are probably the best at doing so, but I'm very, very excited. And again, for the panel itself, we're having the different personas, if I may, that empower that kind of open innovation. So without further ado, let's dive into it. Thanks again, Yara. Thanks, Alejandro, for the wonderful introduction. And thanks for all the hard work of the people behind it. But now we have to get going. And hopefully, and for everyone here, I always mix it up. But here, please take the time to introduce yourself. We're going to be together for a few hours now. The first panel will be about like 40 minutes, and then we'll dive into the tables. But the best way to take the best advantage of the conference today is really introduce yourself. Let us know what you're looking for, what you can offer. Don't hesitate to share some insights. During the conference on Hopin, you can still go on creativecollisions.cc to join us if you're live on Facebook or whatever. And if you are online and you want to share about it, use the hashtag CreativeCollisions again. So without further ado, let's get this going. Thank you, everyone. Hello, everyone.
Oh, hey.
Hi.
Very happy to see you all with us today. That's very, very exciting. Thank you very much first and foremost, for accepting. I know you're all super busy, so thank you so much for being with us today.
Thank you for the invite. It's a pleasure to be joining you today.
Thanks for having us.
Thank you. Well, some of you I know, some of you I know more, some of you I know less. But the reality is that we have more than 600 people today, and a bunch of them don't know you yet enough, and they should. So I can try to introduce you. I won't be doing a good job. I know that the startup usually we tell them like, hey, give me your elevator pitch. So maybe if we can start by a little introduction, like don't dive too much into it. We're going to do that together, but maybe starting ladies first.
Thank you so much again for asking me to join today. I'm Marina Massingham. I'm the CEO of Aifred Health. I joined Aifred back in January of 2019 as a professional CEO, and have been helping to build the team and build the vision and drive the company forward with an amazing team of talent ever since. Aifred's focus as a company is clinical decision support and mental health. So we help doctors to make better decisions in treatment management and treatment selection for the care of their patients. And the goal is always to get more patients within a population to remission and help those patients to get to remission faster.
Thank you. Thank you. Terence?
Yes. Hi, everyone. So I'm Terence. I'm one of the co-founder at Valence Discovery. So we're a machine learning team spun out of Mila, which is the world's biggest deep learning academic institute. And what we're doing is AI-enabled drug design. So we partner with R&D organizations of all sizes, from academia to biotech to large pharmaceutical company. And what we do is just helping them design better drugs faster with different type of algorithm technology.
Okay, so using AI, I love that. I love that. Hassan, can you tell us a bit more about you?
Yeah, thank you so much, Ilya. So it's incredible to be with you today, and big thanks to Montreal NewTech and Centech for giving me the opportunity to be with you. So my name is Hassan Chouaib. I work for Servier. Servier is an international pharmaceutical group governed by a non-profit organizations with a presence in 150 countries and with more than 22,000 employees in the world. So we have medicine in 5 different therapeutic areas with more focus on oncology. And for my role, I'm in charge of the new artificial intelligence hub of Servier based in Montreal, Canada, and I'm data science ambassador as well.
That's a lot of hats, but we're going to talk about the AI hub in a few minutes. But as you see, there are drug discoveries, AI, researcher, entrepreneurs, larger company, and of course we have to talk also about the whole support ecosystem that comes here. So last but not least, Evgeny.
Thanks for having me, Elias. So I'm Evgeny. I'm the CTO of the Digital Technology Supercluster, and the Supercluster is actually a public-private organization that invests in collaborative innovation, very similar to Creative Collisions in a way. And I actually joined the Supercluster in 2018 from the digital health companies, where I spent around 25 years. So we continue on that track, but Supercluster is not only about digital health and precision health. We also tackle some other important digital transformation issues.
Wonderful. So we have representation from the whole Canada here, and Servier is, I think, also a French company. So I love this kind of like international flavor to our creative collision today. Let's dive into it. You know, we have 2 startups around the table, and they have really interesting journeys around this kind of like collaboration and how they came to it. Marina, maybe regarding Aifred Health, can you comment a bit on that journey that brought us to you today? And I know you have some good news to tell us also, so maybe mix them both.
Sure, thank you. I love to talk about our journeys. So Aifred was born back in 2016. It was the brainchild of 4 amazing co-founders who were still students at McGill when they came up with the concept that then became Aifred. There were 2 neuroscience students, 1 machine learning student, and 1 clinician in training. They put their heads together to really look at the problem of how complex mental health conditions were being solved within and managed within the healthcare system, not only in Quebec, but around the world. And they decided to zero in on depression. And one day a McGill supervisor came by and said, "Hey, what are you doing?" They described the project, was told that sounded pretty interesting, and was asked if they'd ever heard of the $5 million global IBM Watson AI X Prize, designed to apply AI to solve the world's grand challenges. And then got connected to District 3, who is the representative for the prize here in Montreal, and entered the competition in 2016 with over 700 companies from around the world. It's not a healthcare prize. This is a general prize to use AI to solve the world's grand challenge. So the team has performed amazingly well. And I was fortunate to join them in January 2019, as I mentioned. We raised a pre-seed round. We continued with the journey through the X Prize in parallel. We closed the seed round in December of last year. And just last month, we were able to announce the fact that we are one of the top 3 finalists in the world in this AI competition, of which I'm very proud.
Wonderful. And also like you have some good news around like fundraising, the X Prize. I'd be delighted to see you win that too. We'd be proud as an ecosystem player, of course. And it's a long journey from research, and especially like on the bringing the research from the lab to actually commercialize it. We're not talking about just like coding and getting something, an app of the door. It takes a lot of efforts and energy, and like grateful for all the partners who allowed you to continue over those few years.
Yes, we've really benefited from the partnerships both of accelerators such as District 3, Centech, Desjardins Startup en Résidence. We really benefited from the support from the Quebec government, both directly and indirectly, and from amazing research collaborations with people like the Lady Davis Institute, the Douglas, the Departments of Psychiatry at McGill, and the Steinberg Research Center. I think of Aifred as a very proud product of an amazing ecosystem of accelerators, government support, and world-class researchers.
Wonderful. And that's actually what we want the people in the audience to also understand, that there is a whole bunch of players for you to help you move your innovation forward. And then speaking of research, Terence, you have a big background on research, even though you're still very young. I don't have my hair anymore, but can you tell us some organizations? I know that you're part of a research center as well, and getting Valence out of the door. Can you tell us more about it?
Yeah, so so my background is in molecular biology. So I did my undergrad, master, and started a PG in molecular biology. And quickly during my research, kind of realized that one of the axes of my thesis project was to better characterize a novel enzyme, and through this project, we quickly realized that there was probably some clinical relevance, that this new target could probably be used and targeted with new molecule to try to design medication for patient affected by different type of cancer. And that's really how we got interested, or personally, I got interested in oncology. And with that project, kind of had a closer look to the drug discovery process, and realized that back in 2019, 16, there was a lot of there was not a lot of folks who were using AI or mathematical technology to really inform and extract more information from the data generated and processed. And one of the biggest limitation in deep learning applied to small molecule design is the lack of data. I think everyone is aware that most traditional deep learning technique requires a lot of data. And so there was a big mismatch between the data environment of this industry and the state of deep learning. And so we were lucky to with my co-founder, Prudential, who was doing his PG at Mila, he got funded by Pfizer and Merck for its PhD to really try to solve this project. So developing new technology that were adapted to the constraint of small molecule design. And so that's kind of how everything started. So we work with them, design new technology, and validate them in the lab, and kind of realize that, okay, it's possible. We can learn high performing model with small data sets. And so through different interaction, discussion in the ecosystem, we were like, okay, we're up to something here. Let's try to provide or make those technology more accessible, not only to big pharma, but also to academic group, small stage biotech. And that's how we decided to launch the company, really with the mission to make deep learning and accessible to drug discovery, but for all the organization of all sizes.
Thank you very much, Terence. And I love both examples on how actually science and deep tech can be commercialized with the support. And there is no better example than both of you. So thank you very, very much. And you talked about big pharma. I'm not going to use the word big, but like pharma. But so we have Servier with us today, and Hassan, I know you have dozens of collaborations around the world around collaborative innovation, open innovation. And you've been, I think, in Canada for longer than most of us here in the table are alive, actually. Can you tell us a bit more about that, as well as what brought you to open recently your AI hub?
Yes. So the idea started 2 years ago to start to create a new international spot in the aim to accelerate the adoption of artificial intelligence. And the first place that we chose was Canada. Why Canada? So Canada today assembled one of the great concentrations of AI talent, as much as academic research lab, biotech, and startups. And Servier believes that there is a political motivation and support behind this ecosystem, which make it more organized and tighter than other ecosystems. That's why we decided to start here. So today, the hub have two main objectives. The first one is to have a local team here with advanced expertise in AI to support the development of global projects and to support the existing data science team. And the other one is to promote and establish and maintain interaction and collaboration with between the players of the ecosystem and the R&D international team of Servier. So that's it.
We'll dive deeper into the collaboration, but as you highlighted the word, we're lucky enough to have the Digital Supercluster with us, and in a way, it's a weird anniversary to join all of us today on mid-March because we've been around with COVID for a year, and the Digital Superclusters and the other superclusters were really key into how Canada reacted to the pandemic and fostered innovation in a very, very fast way. Many people around the room, still don't know what the digital superclusters mean. I'm lucky enough to work at Desjardins and Montreal NewTech, and we collaborate with different players. And when we invited you, people were like, "What's that?" And I'm like, "You should know them. They do amazing work." So, Evgeny, can you tell us maybe a bit more about the digital supercluster itself, as well as the dynamic that you're playing within the ecosystem, especially in the wake of the 1-year anniversary of COVID?
Yeah, thanks for this, because I also realized that people really don't know that much about the supercluster, and actually that has changed a little bit in the last year because we have done quite a lot of things around COVID. But this is a young initiative. It started 2 years ago, and it's actually the third year now. Will be soon over, and we are part of a family of superclusters. So actually, there are 5 superclusters spread around the country. All of them are Canadian focused, and all of them have the mandate to build an ecosystem of innovation and build that ecosystem by co-investing into projects which are very much into the collaborative innovation, bringing startups, small and mid-sized companies, large companies, but as well as research organizations and universities and even public organizations in collaborating and doing something in the context of projects, of course, that each of the organizations would have not been able to do by itself. So that's actually the whole key of the work that we have been doing. And certainly the superclusters have their specialization. Digital supercluster is a little bit of a catch-all. So we are in the digital transformation space, which is pretty big. So we did try to narrow it down. And we actually had a big focus on a number of things, health being one of them. We started with precision health as being one of the programs. The other one was focused very much on natural resources. And we have seen nearly half of our projects went into actually digital health. And I'll keep repeating it. We're still learning. We are a young organization, but our big mandate is to build such an ecosystem that later on you can refer, well, this is similar to what Silicon Valley has become, or this is similar to what Tel Aviv has become, because of the collaboration and because of the putting all those brains together, and because we have not just built additional projects, but also talent and the possibilities to do partnerships that you otherwise wouldn't have been able to do. So COVID has been very instrumental for us, to be honest, because we are a 5-year mandate. So we actually had to spend all our money by the end of 2023. We will be done end of this month, just because of COVID. Actually, COVID accelerated extremely the investment that we did. Nearly half of our projects went into COVID, and they went very, very fast. We actually have been able to react extremely quickly to the mandate that was given by the federal government at that time, and by June actually. So 2 months after we started the program, the COVID program, we have already invested all our funds that we needed to invest in COVID projects. So we are actually now getting our first results from those projects.
So maybe just like for the people in the room. So and feel free, by the way, Marina, Hassan, Terence, if you have like questions, let's keep that together. You know, like we are lucky to be 5 around the table. So on my end, just to understand, the way the digital superclusters work is you don't exactly give an RFP. You more like you present a project where there is a bit of funding that you can support, and then you're looking for a company, you're looking for a startup or different companies to collaborate together.
No, it's an open call for projects. So practically what we do is we have themes. We say these are the challenges, and from the very beginning we kept the challenges very, very broad, and then consortiums come together. So companies, private sector, of course, but also the public sector and universities, they form their proposals and they present those proposals to us. So we have been running the cycles of calls for projects since the very beginning, and COVID was one of those cycles. So practically you get together, you have a great idea, something that you wouldn't have done together or alone, and you have to do it together with somebody else. You present it as a proposal, and we actually were helping develop some of those proposals that were initially presented as expression of interest to become a real proposal that will be big enough to be able to get our additional funding. And it's a co-investment model. So you have to put some skin in the game. So normally it's a one-to-one match. Generally, it's a little bit less, but it's one-to-one match of what the private sector invests with what we are adding additionally.
About private sector, we're looking at Marina, Hassan, Terence here. So like it's half-half. Basically, if you have 50 cents, they give you the other 50 cents. Not bad at all. So yeah, Marina, you know, like the company has been around for a while. I think you recently raised funds thanks to a variety of players, but it has been a long way. Is there any specific lesson learned or something you would have done differently to get there faster or better?
I think that's a great question. So the type of tech we develop is very, very complex. So with the resources we had available to us, this did require time, and I think none of that time was wasted. And therefore, in terms of development cycles for our core AI model, it was time well spent. Where I think we could have accelerated a little faster was when it came to taking our platform for delivery of our technology and testing that with the research collaborators that I mentioned before. I think we learned a lot along the way around how to frame research collaborations in such a way that we as a company answered our questions, but also the researchers had the chance to answer theirs. And we did involve them early on in the design process and development of our product, because there's no point developing great tech if it doesn't fit into real life clinical workflow. And that's what these collaborations really allowed us to do. But I think we could have done that even earlier. We spent a lot of time with thought leaders, and you get great perspectives from them, but you also need to test with the average end user. And I don't think it's ever too soon to start that process. So that's probably, I would say, the biggest lesson that we've learned.
Okay, wonderful. Thank you very much. So speaking of lessons, and we talk about collaboration, I don't know if Hassan, can you share with us maybe one example one example where open innovation maybe accelerated the process? Like as we saw with Terence and Marina, it's something that takes a long time. 5 years can be long, but like in the pharmaceutical, etc., it can be even longer. Do you have an example that you can share with us where it actually became shorter?
Yeah, sure. So as you know, the time taken to develop a new drug from discovery to commercialization, it takes around 10 years with a huge amount of investment, money, and effort. And with the pricing pressure today coming from patients, regulators, and healthcare providers, become more and more challenging. So for many years, we had traditional collaborations about research projects, but 6 years ago, when Servier decided to focus more on oncology, we had a poor pipeline about this subject. So, and we had two options. The first one is to invest internally to develop by ourselves the drugs, or that the second option is to be more open and to try to create partnerships on drug candidates. So we chose the second options, and today, after 6 years, we have already 5 marketed drugs in oncology in the market, and some of partnerships ends by an acquisition. And today, 25% of the brand name medicine revenue of Servier are reinvested in R&D, with a big part in collaborations.
By the way, like, we're 5 around the table. We have a bunch of people in the audience. So we'll get questions from the audience as well. So if you're in the audience and watching us right now, or if you're just on the live stream, Facebook or LinkedIn, join the hub so that you can actually ask the questions, and we'll ask them to our panelists here today. We are talking about the speed, and especially when you're a young entrepreneur, you need that kind of like backing, as Marina said, from the research partners, the universities, the users, to be able to get that there faster, as well as institutes. So, Terence, you had a strong presence in research institutes as well. What do you see as like a tech or research that you're doing at Valence, where that has the greatest potential to grow thanks to those kind of like collaboration with Mila and other institutes and that you have done?
Yeah, so to kind of piggyback on what Marina said, often when you're developing a new algorithms, new type of AI system for complex data environment, it takes time. Like those models that are used for NLPs or other kind of context or application are pretty like mature. Computer vision, NLP, you can find really cool technology that actually can be easily kind of plug and play on almost any type of data set. But when you're dealing with, in our case, small molecule, it's a different kind of data space, and it's hard to try to learn powerful predictive model for a lot of different contexts, and the reality in our space is that there's not a lot of data. So we founded the company in 2018, and so we've been operating in stealth for the last 2 years or almost 3, where we were doing a lot of research with Mila, a lot of collaborators from other AI institutes, because we had to develop new technology if we wanted to bring real value to our industry. We've published probably over 10 papers, and I have a lot of research that are still internal in our platform. And so that's kind of a take-home message I think I want to leave, is that for a lot of complex market and data environment, there's still a lot of space to be done and research to be done on the AI space. And we've just recently came out of stealth. And last week we announced a big partnership with IRIC, which is the one of the leading oncology research institute, where we're helping them to accelerate those drug that they're developing internally as a small academic group, compared to bigger pharmaceutical company, they don't have all the resource. And so leveraging those type of technology to really streamline the process and minimize time and find better drug faster is really needed for those smaller organizations and even for bigger ones. So today we proudly, and we're really excited about this, we announced a big partnership with Repair Therapeutics, which is probably one of the leading biotech in Canada. They last year they break a big record, one of the biggest IPO in Canadian history, and so we're really proud to work with them. They're based in Montreal also, and in Cambridge, Massachusetts. And so even bigger organizations, well-funded, are aware that there's more and more constraint and pressure to kind of advance those drug into the clinic faster, and so we'll see in the next few years more and more integration of this technology into organization of all type, because it's really needed in drug discovery.
So we talk about this kind of like drug discovery collaborations, but we also like almost like biology is becoming the new software, and we've seen the open source movement that has been behind all this internet in a way. And this is for everyone here. Like, what are your thoughts on this kind of like open source aspect in drug discovery and research and open science in general?
I mean, personally, go ahead, Marina.
I was just going to go back to a point that you made, Terence, around publishing. So when we have research collaborations, we publish quite a bit around those. And I think what it does is it brings rigor into the science. It adds to the sum of knowledge in the field and helps to propel everybody forward. So I think the principles of open science, where you are developing something or discovering something that has applications within your field, but also beyond. So in our case, how do you make sure that great digital technology gets adapted and adopted from a user perspective? I think it's very relevant and very necessary to publish that research. And in the process, you get peer review too, which also adds to the rigor of what you're producing.
Okay. Well,
I think I was just going to, I mean, I really agree with what you said, Marina, especially in AI. With the last few years, there was a lot of hype in AI. So like almost every company is claiming now that they're using AI. And when you look under the hood, it's a random forest or like a basic algorithm, which is not really AI or machine learning or deep learning. And so, yeah, to bring a lot of credibility to the field, I think open science is the way to go, and we've been publishing a lot, and we'll keep publishing a lot of our research.
Wonderful. Thank you very much. Evgeny, do you have any comments on this?
I'll take a different point, because to me, I mean, it's fantastic. Open science, publishing, that's good. But at the end of the day, what we have found out is that there's a huge gap. And I would even not say it's a gap, but the research and the clinical practice live in two different worlds. And especially when it comes to healthcare and when it comes to, for example, life sciences. So to me, there's a still big thing to be done to make that open science or that research results really computable, directly applicable in practice. So it's one thing to publish a paper and then wait for 17 years for that paper to be put into practice. It's another thing to publish something which is computable, which is knowledge that is democratized and is capable of being put into clinical practice. Not immediately, of course, and not everywhere, but at least it's made available in a way that open source, for example, is made available. You can not only just contribute to it and copy some ideas, but you also directly put it into your products. So that's how I would like to see the open science development, that actually it makes the connection between the clinical practice and the clinical research in very much the cycle of learning health as this has been used as a paradigm some time ago.
Okay. So speaking of that aspect of realizing where you are and where you're heading, we have questions from the audience, and I think we have Karim Atassi who's wondering, what are some of the steps that you would advise someone who's a researcher potentially, who would like to be part of the startup ecosystem, or who would like to launch a startup? Is there any advice that you would share as a next step between the research part or the realization that that's what you want to do, to becoming an entrepreneur? Is there any specific piece of advice that you would like to share, maybe among the entrepreneurs we have in the room?
I don't know if you're in Canada, but the way I got into entrepreneurship was through a Front Row Venture, which is a student-led VC. So we were a group of students investing in other students that were starting their company. And depending on which type of company you're thinking about building, I mean, we're all talking about deep tech, and so in deep tech you kind of need funding because it's often expensive to develop this technology. And so having a good understanding of the other side of the startup ecosystem, which is the funding ecosystem, so like VC, was really helpful for us. Yeah, that's where I met my co-founder. That's where I learned how to build a company and understand how to raise capital, and that was super helpful. There's also a lot of kind of academic entrepreneurship institute. Centech is a big one in Montreal, that really are there to guide students and researcher to help them commercialize their research.
If I may add to this quickly, and yes, Evgeny, and then we'll move to the future because we don't have that much time left. But if I may add, for anyone, like I saw a few questions. We have Jesus Odiaranda who's talking about like how do you get your first customer? Then we have a few other questions around application or applicability. My advice for anyone who's whether a researcher or aspiring entrepreneur is go knock at the doors of a startup, ask to work with them, ask to work for them, join your startup ecosystem players, and get acquainted with what's happening. A bit like what Terence said, he was involved with student organizations, etc. Evgeny, I thought you wanted to add something there?
Yeah, I just wanted to add something that we have seen very much in the startup world, and I think that the most difficult thing in health is not so much about the funding and the product that you'll be creating. You have to know exactly who's your buyer. Who are you selling to? I mean, you yourself, who is your first customer? Actually, you have to start with this before even building anything. And that's very difficult thing in health, especially in the public health system. That's extremely difficult. So I think the biggest hurdle of startups is to be able to really define what their business outcomes are, what is the value that they're creating for whom, and who is the one who is prepared to pay for that value, because they could be very different entities. So this is probably the biggest thing that I think has to be on the mind if anyone gets started on this journey.
I would totally agree. And I would also add to that, what is the need that your customer has, and how is your tech directly solving it? You have to understand that. You have to understand the problem and the need, and exactly where you fit and how and when and why, in order to capture that customer.
Maybe I can add that we start having more and more openness on defining program to help the startups. So, for example, at Servier, we have some programs like Startup at Servier that we are promised to co-develop projects with startups without having any obligation on collaboration or any commitment. So we are ready to co-develop and put money to co-develop projects even without having any obligation. So don't hesitate to look at this kind of program and to contact big companies about that.
Contact big companies. So we talked a lot about this kind of collaboration, understanding your market, and we had a few questions about like how do you actually get that first client. I think those answers are very insightful, and starting with working there and hopefully inspiring you to become an entrepreneur as well. And so don't hesitate to ping. I know that Valence is hiring. I know that Aifred is hiring, and we just saw that Servier as well.
Even Servier, yeah.
Even Servier. So here you go. Everybody is hiring. But we are here to talk also about the future of healthcare. And this is a question for everyone, but I would love to see, where do you see, like we're all building this future together, where do you see healthcare being maybe in like 10 or 20 years, starting from now? That's an easy question, eh? Don't fight over it.
So maybe I can start. So,
go ahead.
So,
go ahead.
Yeah,
No, vas-y.
So, I still believe that 20 years from now, the data will be still centric and very interesting, and we're gonna have more and more AI technology using this kind of data. Maybe we're gonna have a worldwide international infrastructure that allows us to access and to share all the patient data across the world. And maybe we're gonna have some microchips in body that generates data, and we're gonna have some AI algorithm that check always on the health of the patients to facilitate monitoring, for example.
Evgeny, maybe?
Okay, let me take a different approach. So let's take COVID aside. So you've probably in 2019 have been to see a doctor, right? You remember what the experience was, and if you're old enough, as I am, you probably have seen a doctor also in the 90s. But if you have not, you can ask your parents, and then they can tell you what the experience was. Was there any difference? 30 years? It's exactly the same. So that's why I like maybe 20 years is a short time. But if you start looking really ahead, I think things will be extremely different. And let's take some examples. I think primary care will be different. Primary care will be about staying healthy, not about treating the sick. It will be much similar to a social network rather than a bidirectional relation with you and a doctor. Maybe even you don't have a doctor. Maybe you have the patients like me environment, which you're working with your peers and various kinds of other data sources and the open knowledge we have been talking about. It will be mostly virtual for that matter, because you cannot bring everybody together in one place. And we have seen that with COVID. It will be totally multimodal because you have many different sources of data, and it will be a lot more objective because you have these, you mentioned IoTs and various kinds of remote monitoring devices. But also hospitals will be different. I think that we might even not have general hospitals. We might have a very specialized set of hospitals, and all the diagnostic services will be outside of the hospital. And maybe your home will be turned into a medical unit whenever it's needed. But something else, because I noted that actually when you said technologies, you're focused on things like artificial intelligence, quantum computing, IoT. You probably missed one technology that I'm very interested about. And I think that the health will be very much driven by the economy. So I think that health economy might actually be different. I would not be surprised that in 50 years, we actually don't have health insurance. And it could be an AI-based smart contracts on a blockchain that actually drive everything. So pay attention to DeFi and to crypto economy, because that might change the entire healthcare world, at least in my opinion.
I love that. I wouldn't have expected to talk about blockchain, Bitcoin, DeFi. And I think, you know what I love about this kind of like creative collision that we're trying to build is that you're always surprised at how like those ideas can come and actually create something that you would have not thought of. So thank you very much. That's super insightful. I know we have some insurance companies around the room. I personally work at Desjardins, and I think we have to also keep an eye on that, because that's true that whenever, yeah, okay. So whenever we're talking about healthcare, we're also talking about insurance. FinTech is very close to that, and the whole economy behind it, because those are like some key components. We're going to move to the breakout rooms in a few seconds. I would like one last question, and I apologize, Denis and the others. I know Yara is going to join and I annoy them, they annoy me. But I would like to bring this back before moving to the breakout sessions to Canada, and where we're all here today. You talked about AI, and we have some wonderful startups here. You talked about the AI Hub. Do you see any gap or any opportunity or specific fields where Canada can really and truly become a leader building this future of healthcare and life sciences?
I think with the expertise of just the talent pool in AI in Canada, I think there's a possibility that we could maybe become one of the or become one of the leader in kind of biotech. We used to be a big biotech hub, especially in Quebec. 30 years ago, and all of those R&D organization left, and now we're seeing a resurgence of those this intersection of like life science research, AI. I think there's something there, and if the right infrastructure investment mechanism are here, I think yeah, we're primed to become a big biotech hub again.
Thank you. Absolutely, and especially as you were talking about coding and how the biology is basically like a new way to code. So, and you were talking about AI. All those subjects are really key. I would love, and we have 3 breakout sessions, and I would love if we had like another one at the crossroad of biotech and coding, because I think we have some wonderful talent around the room. And this is something I would, so next one, we'll have one on the blockchain and one on the coding aspect, and like what does it actually mean to be able to be a leader in biotech. Maybe any last closing comments, any call to action, any remark before we jump to the breakout sessions?
Well, the only thing I would say it is so people that don't know about the superclusters, it's not only about the digital supercluster. You have one in Montreal, the Scale AI. Feel free to engage. I mean, you can gain a lot from these organizations. We got startups that are participating in as many as 8 projects at the same time. And somebody that really is eager to collaborate can gain a lot out of these projects.
Absolutely, absolutely. And we were lucky to have all the superclusters during summer at another Creative Collision. And I know a few of the startups that were at the Creative Collision that actually engaged with Scale AI. I don't know about digital, but I know about Scale. So yes, feel free. Of course, for everyone here in the room who's wondering, we're going to send you an email with all the details of the speakers, but feel free to engage with them. Feel free to send a message to Montreal NewTech, Desjardins, Centech, District 3, and all Montréal InVivo, sorry, forgot them, and all the other co-organizers of this event to get access to the information, etc. Yes, Terence?
No, I was just going to say that we're also hiring for every position, from BD, chemistry to machine learning scientists. Feel free to reach out on LinkedIn and follow us on Twitter and LinkedIn. There's a lot of exciting news to come, so we're looking forward to announce more exciting partnerships.
Up. We cannot spill the bean, but that's wonderful, and I love seeing the growth of our startups here. Hassan, Marina, maybe any call to action or anything you want to share with the audience?
I think one of the things we should think about is we have all this amazing technology that's being developed in Quebec, all of this great innovation. I would love to add to a future roundtable the question of how we make sure that this really gets integrated into the health network of Quebec, so that all of the problems that we're solving and all the tech we're developing actually has its first customers in Quebec and it gets used by Quebec physicians and Quebec patients. For our side, we've been great at being able to have collaborations that have put our technology into the hands of Quebec physicians and patients. We'd love to see companies like ours and others really bridging that gap between creation of the technology and adoption to the benefit of people in Quebec.
Thank you very much. Merci. And I think Evgeny and you should talk further. Maybe he or one of his colleagues at the superclusters can help propel that and find the right incentives to move this forward, because
we're open.
If we can get this going through a Creative Collision, you'll make me happy. So
absolutely.
Thank you very much, Marina. I know that Hassan has to go for the breakout session. I don't know if you have any call, I have a call to action for everyone here in the room is go and join the breakout session right now. If you're not on Hopin, come to Hopin. It's www.creativecollision.cc. I know it sounds like CC, Creative Collision. And join Hassan at the breakout session.
Thank you so much.
Thank you very much, Hassan. Thank you very, very much, Evgeny. Thank you very much, Terence. And I'll finish with, last but not least, of course, thank you very, very much, Marina, for joining us. I know you're super busy. Like the dynamism of the ecosystem here is wonderful. Thanks for your insights. It was very, very, very insightful. And thanks for your generosity of time as well as transparency in the discussion. We would love to keep on going. We have the breakout session, unfortunately. We're going to dive deeper into the subject because we want to move from the lesson learned and the projection to the actual action. We're lucky to have more than 100 researchers, 100 startups, and about 100 professionals and entrepreneurs, and definitely looking forward to how we can better collaborate, help commercialize, but also help create new innovations today. Thanks so much for taking the time.
Thank you so much.
Really appreciate it.
Thank you, Elias.
Have a wonderful day. Talk to you very soon. Thank you very much. I think we have someone joining us in a few seconds. I don't know what's happening on your screen.
I am not sure what's. Oh, there we go.
Oh, maybe you're just like too bright. You're such a bright person that
the light couldn't handle it. Elias, that was such an interesting conversation. I know that for fellow entrepreneurs, researchers, and investors, that conversation really helped shed light into next steps, right? And we talked a little bit about some calls to action. What do you think the most interesting part of the conversation today is going to, like, what's the outcome of the conversation today? And how can, maybe, one question that I thought was interesting.
Okay, so all my other questions weren't good enough?
No, I think so many good questions, but it's like there was a lot of content and there's a lot to unload. So if you were, for people who are joining in right now, what would you say the top 3 things that came out of the conversation were?
What I found actually really interesting, well, beyond from a holistic perspective, I think the diversity of players was key in also understanding how we can actually collaborate. The fact that, for example, Marina, who's leading Aifred Health, is collaborating with researchers and looking onto how do you get that adoption in the hand of the user. And you have, on the other hand, you have Evgeny, from the Digital Supercluster, who is giving almost, he's doubling the investment to allow you to commercialize. And you have a Servier, on the other hand, who's a company who can help be a partner. So for me, that's one of the main lessons, to be honest, as an entrepreneur or as someone who wants to launch or who's someone who's already in the field, to put yourself into Marina's shoes or to put yourself into, not Valence, Terence from Valence, shoes and see Servier, see the Digital Supercluster as actually partners and clients. And I think this is really key when we talk about open innovation, to perceive the client as a real partner. And you can co-develop your solution with the support of the ecosystem and the funding that comes with it. So there are too many. But the other one I was surprised actually is like when Evgeny was talking about the blockchain from an insurance perspective and the economics of that. I didn't see this one coming, even though, like, obviously I'm lucky enough to be part of Montreal NewTech, Desjardins. So I see the insurtech aspect behind it and seeing how we can build the 10, 20 years and keeping in mind the economics of it, the insurance aspect of it, and exploring technologies such as Bitcoin, blockchain, etc. I think that's really cool because we're talking a lot about Bitcoin now because it's like going like this and going super up 7 times in 1 year, blah, blah. But coming back to the innovation behind it, that was really, really awesome. I'll stop there because otherwise we'll go for another panel here.
I agree. We want to thank all of our speakers and Elias, of course, for helping lead the panel. We want to make sure that everybody on the main stage heads over to the breakout room. So click on the sessions button on the left-hand side of your screen to head over to the breakouts. they're going to be led again by JLabs, Servier, and AstraZeneca. What do you want to say, Elias?
I was going to add to that because I'm not sure, like everybody, some people are on LinkedIn, some people are on Facebook right now. So just a little reminder, this is happening, part of Effervescence. This is a collaboration between District 3, Centech, Montreal NewTech, Desjardins Open Innovation, and Montreal NewTech. We have 3 breakout rooms happening, but you have to join Hopin. Like if you're on Facebook, you're on Facebook. If you're on LinkedIn, you're on LinkedIn. You cannot. You have to join Hopin. So it's on creativecollision.cc. I know it sounds .cc. It's a new type of domain name.
It's in the description. So on Facebook, on LinkedIn, in the description below, you will find the link. Registration is free. It takes a mere few minutes. Hopin is an easy platform if you haven't used it in the past. And make sure to not only join the breakouts, but also the networking that's coming right after. For all of our attendees already in Hopin, start making your way over to the breakouts. And I'll see you on the other side.
We're not supposed to have anyone anymore now. Like no
one.
No.
Now it should just be you and me.
So please don't watch us. Stop watching us. Get out. Get out. I don't want you to see me or watch. Not that you're not wonderful, but I think we have to move on. There are amazing collaboration happening, and again, like each breakout room, and we're going to display them. But like we're talking about quantum computing, we're talking about machine learning and AI data science. We're talking about wearable sensors, and each room is propelled with the real challenge. So for example, in the case of Johnson & Johnson, they're actually asking how can quantum computing transform drug discovery. And we have Servier around how can machine learning and data science improve patient selection, prediction of treatments, and response to personalized medicine. And finally, AstraZeneca on how can wearable sensor and digital biomarkers improve patients' treatment outcome. So we have all those rooms where we have researchers, startups, and the companies there. They want to share with you and they want to collaborate with you, and they really mean business. I know that Evgeny talked about the economics of it, but they mean business. So if you're an aspiring entrepreneur, if you're a current startup, even if you're not specifically in those fields, and I repeat myself, even if you're not specifically in those fields, join one of the rooms, ask questions, interact with the people, and stay for the networking, because that's how you get involved in the ecosystem. That's how you launch successfully your startup or join a successful startup, and that's how you're successful in the ecosystem. So please don't hesitate, go. If you have any questions, we are here for you, the whole team and the co-organizers. So thank you very, very much. Thanks, Ciara, for joining us as well. It was really awesome having you.
Thank you all for having me. All right. Thanks again, everybody. And I'll see you all on the networking end.
See you in the breakout.